Welcome back to American Medicine Today. I'm here with Dr. Bonati, and we're going to be answering your Facebook questions. So the first question we have is from Teresa, who has already undergone a fusion in the past. Now she has a slip disc and scoliosis, as well as nerve damage to both legs and drop foot. Can you explain how these conditions may have resulted from the fusion and what can be done to help her?
I don't know what conditions she had before the surgery.
Sure.
But if she didn't have these conditions before the surgery and then they appear after the surgery, that indicates a lot of damage created to the fifth nerve root. And the fifth nerve root goes from the back, goes to the hip, goes to the side of your thigh, the side of your calf, and the foot. And if that nerve is under pressure or injured, then you develop what we call a foot drop.
Right.
And the foot drop is just only weakness. And when the patient has that problem, they walk within special type of a gait.
All right.
It's like they are lifting the foot to be able to mobilize.
But is the foot then like limp? How does that work?
When you have a foot drop, the nerve is paralyzed.
Sure.
So I hope that this nerve is under pressure.
Okay.
And is paralyzed because of the pressure. If that is the circumstances, that can be corrected.
Now we have a question from Wilson. Apparently he was in a car accident as a pedestrian, and he has 2 broken titanium screws, this sounds horrible, at L4 and L5 since the accident, and he suffers with severe pain on a daily basis. It's extremely hard for him to sit, stand, or even do normal activities. Do you have any recommendations for Wilson to find a pain resolution?
If he had these problems before, then I need to see the x-rays. Those screws may be broken a long time ago. And if the break of the screws occur after the car accident, that means a tremendous force happened in the back.
Yes.
And that is going to create an area that these bones are going to mobilize. And if that happens, that's the symptomatology that he has.
Sure.
So please don't put another fusion and don't do any more screws.
Right.
Those things usually don't work. So if the situation needs to be a decompression, they need to take the screws out and need to free the nerves, and he will be free of pain.
Now we have a question from Carrie. She's getting injections for a herniated disc in the neck, but will those injections help fix the neck herniation?
No. The injections is being described as a conservative treatment. Practically, I think it's a waste of time.
All right. And why is that?
At the same time, well, because if you have pathology, if you have your finger caught on the door and somebody tried to just pet you a little bit to give you some comfort, that is not the solution. Solutions open the door, take the finger out.
Correct.
Well, the same thing on this. This is a mechanical problem.
All right.
If it is a mechanical problem that is compressing the nerve, nothing else is going to correct that. And these injections are, at the same time, they are being abused.
Sure.
Because you give an injection, the patient gets better for around 2 weeks, a month, or something like that.
On the first injection?
On the first injection.
Okay.
And then the patient come back and they give you another injection, and they give you another injection. The first injection usually works a little bit.
Right.
Because remove the inflammation in the area.
Sure.
The second injection doesn't work anymore.
Okay.
And the third injection is totally useless.
So every subsequent shot after the first basically
useless.
has no benefit.
Yeah. But yes, no benefit, but has some problems.
Okay.
One of the things, every time that they give you a shot, you're going to put weight. So if you
because it's a steroid.
Yeah.
Okay.
And if you do put weight, and imagine that you have a diabetes, then it's going to create a scandal in your blood sugar.
Sure.
So you do have an elevation blood sugar. Now you need to correct the blood sugar. All these things they need to study before you start to give injections.
Right. And you only do post-operative injections just to help with inflammation once the surgery is over, correct?
Not all the time,
Okay.
but when we do and the patient has some sensitivity
Sure.
that is not routinely in our practice, Then we give them some epidural, and,
Sure.
and the patient has immediately relief of that sensation.
Right, and it's not done the same day of surgery when you do it, so it wouldn't mask any pain.
But we don't do that thing as a routine.
Correct.
We do when we see a patient who had an inflammatory process after the surgery, and then that helps the patient to that little hump of the discomfort. And then when that happens, we don't repeat the injections.
Right.
Because as we said before, the first injection works, the second doesn't, the third one is useless.
Correct.
So we do one injection, and then the patient feels better,
Okay.
and help us to remove that post-operative discomfort for the procedure after the surgery.
Sure.
If the patient has some discomfort. If not, we don't do it.
We have Kathy who wrote into us and said 30 days post-op from a discectomy for a herniation at L3, L4, the sciatic pain was gone in the first week, but despite following all post-op instructions, some pain has returned. Does she have other options if the pain doesn't go away?
Well, this is very important. I always emphasize to the patients that when you have an injury on the spine, you don't have an injury in one spot.
Sure.
Now, I don't know the history on this lady, but if this lady has, for example, a fifth nerve root pain, and the fifth nerve root was gone, I mean, she's saying right there that the pain on the back of the leg was gone, correct?
She said that the sciatic pain was
Yeah,
gone, but
let's-
some pain returned.
Yeah, let's understand the sciatic pain like pain on the back of the leg, because
Sure.
that's the area.
Okay.
Some people just talk about sciatic as any pain on the leg.
Right.
That's not correct.
Sure.
So the pain on the back of the leg is gone.
Okay.
If the pain on the back of the leg is totally gone, then that indicates the surgery was okay, and she may have a problem in the above level or another level of the spine, and that's the one that's giving her the symptoms.
Sure.
But if the pain returned in the same level before the surgery, the surgery didn't work.
Dee Dee was told that she needed a discectomy and a fusion with hardware at L4 and L5. And we know the Bonati Spine Institute doesn't perform any surgeries with hardware. So can her condition be treated?
Yes, absolutely. The only thing that I hope is that she doesn't run to have a fusion, because
Another
it's
one,
going to make
right.
Yeah, because then it's
Or
going
at
to
all.
make the things too difficult for her and more problems.
Yeah, because we all know with fusion surgeries, typically a one-level fusion fails 65% of the time. And if someone's talked into a 2 or 3-level fusion, that failure rate skyrockets to 85%.
Yeah, and the
Scary
length of the
stuff.
fusion, the survival time in the fusion, usually in those percentages is around 2 years.
Right.
Then after 2 years, the whole thing collapses.
Right. That's a very grim outlook. So if you want to stay healthy, especially in this new year, you probably want to avoid fusions at all costs. Thanks for joining us on American Medicine Today.